Prostate cancer is very common. 1 in 6 men in the lifetime should expect to get prostate cancer. It is definitely a disease that affects older men. Traditionally, we used to be specifically concerned about prostate cancer in any man over the age of 50. Recent studies have shown that there are a significant number of men, even in their 40s, that are susceptible and at risk for prostate cancer. So we are looking to screen and concerned about screening in men over the age of 40. Historically, with prostate cancer, usually men would present with metastatic disease. They'd present either with bone pain, weight loss, or inability to urinate. In the late 80s and early 90s, there was they determined that a specific marker for prostate cancer was PSA. It's a protein made in the prostate. Men with prostate cancer, PSA is elevated. We now screen men for prostate cancer by checking the PSA. One thing I like to tell men is prostate cancer is very common. As we talked about, 1 in 6 men have it. The other thing about prostate cancer is we have a lot of very effective treatment options. Recent data suggests that men with prostate cancer, the chance of them living 5 years is almost 100% with prostate cancer, and their 10-year survival drops to only 90%. One thing we're looking at nowadays is, even though we have a diagnosis, if it's very low stage early prostate cancer, some of the options are observing it. We continue to check the PSA, and if the PSA rises, we do a biopsy and then offer treatment. In younger men, we specifically discuss surgery. I think that offers one of the best options of cure. We also have some very effective options with radiation. There are 2 types of radiation to treat prostate cancer. One is with external beam radiation, where a man receives 40 radiation treatments 5 days a week for 8 weeks. There's another treatment option called brachytherapy, where some radioactive seeds are implanted into the prostate, and it's treated that way. Now, with Intuitive Surgical and the Da Vinci robot, we now remove prostates robotically. It has caught on very rapidly now. The last year, approximately 75 to 80% of prostatectomies performed in the United States with the Da Vinci robot. I think there are numerous advantages of the robot, and I think that is what some open surgeons say that perform it traditionally open, is the robot allows you to mimic open surgery with a robot. Some of the benefits of that are, as we talked about, with open surgery, there's traditionally a 5 to 6 inch incision. With the robot, we make 5 very small 1 centimeter incisions across the abdomen, and we use robotic arms that enter through these incisions to remove the prostate. I think in the immediate during the surgery benefits of the robot, first of all, we use a camera that has 10 times magnification, so the visualization of the surgical field is much better with the robot. Before the robotic surgery, we were using laparoscopic surgery, and that is a minimally invasive approach to removing the prostate. I think where we get the real benefit of the robot with prostate surgery is the robot has mechanical arms and wrists, and you're able to use those wrists to technically remove the prostate, and it allows you to mimic more open surgery. Another benefit surgically during removal of the prostate is blood loss. Usually blood loss is probably 1/4 to 1/5 less than open surgery. Historically, most patients with an open prostatectomy would receive a blood transfusion. Now we rarely ever transfuse.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.